Hello everyone, my name is Dr. Anand, your Pediatrics faculty. Today, one of the most awaited video we have today is how to take a case presentation. Yes, exactly, how to take a case presentation. The first format we have, you all know, whenever you're taking a case, we have this name, age, sex and residence. So basically, we always start like, good afternoon sir, I'm presenting a case history of patient named Rahul. He's 4-year-old male, Hindu by religion, Punjabi by community, residing in Lajpat Nagar, New Delhi. Informant is the mother and she is reliable. Second by birth order, born to a non-consanguineous marriage, belong to a lower socioeconomic status, came with complaints of dash. This is the perfect format of how you take a case. It's a starting punchline. I'll repeat again, let's go one by one. The question number one we have is why? Why do you take a name of the patient? Why it is important to know that my patient name is Rahul? Number one, we take the patient name, number one, for identity. Number two, for the hospital records. Number three, very important to have a patient-doctor relationship. And last but not the least, by knowing that my patient is a Rahul or Hamid, we can get to know the eating habits of the patient. If I talk about the eating habits, so we have two questions. If I eat uncooked pork or if I eat uncooked beef, what all problems we can have? So have you heard of the problems of tinea solium and tinea saginata? Most importantly, have you heard of neurocystic sarcosis? Yes, exactly. Neurocystic sarcosis happens when you eat uncooked pork or uncooked beef. Let's have one more MCQ over here. What is the hallmark of neurocystic sarcosis? Please remember, on the imaging you will have a starry sky appearance. Yes, very good. So that is the first point why we take the name of the patient. Next, very important, sex. Why sex is important? My patient is a male or my patient is a female. Why it is important for to know? Can you name some problems which happen in males? Number one is color blindness. Number two, can you name out any syndrome which is common in males? If I ask you MCQ, 27-year-old couple, they trying to conceive a baby. On further examination, the husband had a tall stature with gynecomastia with micropenis. So what do you think? What is the answer for this question? Klinefelter syndrome. Yes guys, so male patient with all these problems, you will think of Klinefelter syndrome. Please remember that. So I'll say again, why sex is important? The problems seen in males are, number one is color blindness and number two is Klinefelter syndrome. Now coming to the females. Now females, very important. Number one, as you can see that severe acute malnutrition is commonly seen in females. Can you name some syndrome which is common in females? If I ask you a very simple question, a female patient with a webbed neck, a female patient with a webbed neck with short stature with widely spaced nipples. So what is the answer guys? The answer is Turner syndrome. Yes, the answer is Turner syndrome. So I'll repeat again, the problem we saw in the females, number one very importantly is severe acute malnutrition and number two is Turner syndrome. So I'll repeat again, we take the name of the patient, we take the sex of the patient, next is age of the patient. Sir, I'm presenting a case of patient named Rahul who is a 6-month-old baby and it's a male baby. So why it is important to know the age of the baby? Can you name some condition which is common in 6 months to 5 years? In 6 months to 5 years, the common conditions are, number one, severe acute malnutrition is common in 6 months to 5 years. Febrile seizure is common in 6 months to 5 years, and very very important guys, please remember, micronutrients problem, micronutrient deficiency, it is commonly seen in 6 months to 5 years. So number one, name is over, age is over and sex is over. Next important point, residence. So I'm presenting a case history of patient named Rahul who is a 6-month-old baby residing in Himachal Pradesh, so residing in a very hilly area. Can you name some problem which is common in the hilly areas? Have you heard of goiter? And even PDA also. PDA is very commonly seen if people staying in the hilly area. PDA, top 3 question. What is PDA? That is patent ductus arteriosus. Number 2, PDA, it is between what and what? So we all know that it is present between the pulmonary artery and descending aorta. Last question, PDA, is it a cyanotic or acyanotic congenital heart? Yes, it is a acyanotic congenital heart disease. So name over, age over, sex over, and residence also very importantly over. If the patient is residing in hilly areas, he can have goiter or he can have patent ductus arteriosus. Now last but not the least, very importantly, if I say again how to start speaking about a case presentation, Good morning, sir. I'm presenting a case history of patient named Rahul, who is a 4-year-old male boy, Hindu by religion, Punjabi by community, residing in Lajpat Nagar, New Delhi, born to a non-consanguineous marriage, third by birth order, belong to a lower socioeconomic status according to Kupuswamy. An informant is the mother and she is reliable. Next question, last question. How do you define informant? Can mother be the informant? What about the father? And what about the grandfather? The definition of informant is someone who stays with the baby 24/7. That is known as informant. I'll repeat again. Someone who stays with the baby 24/7. That is known as informant. So yes, mother, grandfather, anyone could be who stays with the patient 24/7. So this is the one of the important videos of how to take a case presentation, the format, that name, age, sex, informant, residence, Hindu by religion, Punjabi by community, born to a non-consanguineous marriage, third by birth order, and informant is the mother and she is reliable. So thank you so much everyone. Do like, share and subscribe, and see you in the next segment. Please take care. And before leaving, we always have a quote. And what is the quote for today? The quote for today is, work until you feel Dubai is very, very cheap to go for shopping. So please take care and thank you.